The Morpheus 8 has retractable pins and they vary in length. You can adjust the length from 2 to 3 to 4 millimeters. If you look at the plate to which the energy travels from the pins to the negative plate, it's all the way around the tip, as well as there is a lattice network between the pins. And as a result, the energy distribution is much more even and heating up of the deep tissue is much more even. With the Morpheus 8, the machine drives the pins through the skin with each application. And as a result, the human area is removed and the penetration holes appear to be much cleaner. The Fractora handpiece has pins that are preset length. That does not change. Also, the energy from the pin tip travels to a plate, one on each side of the tip. They're parallel. However, it's not all the way around. So you have 2 instead of 4 plates without a lattice network between the tips. The energy is driven to a specific place, but it's more concentrated in that area. On the left side, we use Morpheus 8. It's at body setting, which is 4 millimeter depth. It's 35 watts, where on the right side, we used the 3 millimeter Fractora tip, silicone coated, and that is also at 35 watts. Here, this patient, after the treatment of the left side with Morpheus 8 and the right side with Fractora, it's pretty obvious that the Fractora side has more erythema. You see more punctate bleeding, although the pins on the Morpheus 8 side are longer and penetrate deeper. What I see consistently with Morpheus 8 is that the energy is more evenly distributed. And as a result, I think you get a significant amount of tightening and better tightening while not finding any potential marks or areas of overheating from any of the negative plates at any time. Also, the recovery seems to be a lot shorter and patients show fewer signs of having had a procedure. The redness, erythema, is much shorter and much less bleeding. No evidence of little dots or holes more than a few days after the procedure.